Welcome to Fit, Focus, and 50. Join host Richard Urker as he dives into 4 pillars to thrive in your 50s. Mental wellness, financial freedom, physical strength, and spiritual connection. It's time to take control of your well-being and live your most purposeful life.
Fit, Focus, and 50, caring for yourself while caring for someone you love. Hello and welcome to another edition of Fit, Focus, and 50. I'm your host, Richard Urker. On this show, we focus on physical health, mental health, and financial health in your 50s so you can live a happier, healthier, more fulfilling life. Today's topic is really important to a lot of us. It's how to take care of yourself when you're caring for a loved one who is facing a challenging diagnosis and a life-changing diagnosis. Today's podcast is sponsored by Dr. Kimberly Simons and her team at Baldwin Dental Care, providing decades of world-class dental treatment, including cleanings, whitenings, implants, crowns, Invisalign, and much more, including free second opinions. Call today for your appointment at 636-227-2552. Why does this conversation matter so much? Caring for a parent or spouse, close to your friend, can take its toll on you. We do realize that managing a lot of things at the same time, finances, medication, transportation, meals, all these responsibilities, plus your own at home, can change and cause a lot of stress. With this kind of responsibility, it can be overwhelming. So I'm really excited to welcome our guest today, Emily Vallarta, a psychotherapist in her private practice. Emily, welcome to the show.
Thanks, Rich. Good to be here.
It's great to have you here, and I'm excited to learn a lot about what you have to say about this. And you also have some personal experience relating to this. So in the beginning, you might notice, some changes in your parents, right? In your father and your mother. It's kind of their health kind of going downhill slightly. So how would you address that first sort of shock when you see something unexpected?
Well, first, every experience is unique. So for those who have experienced this, it's kind of an initiation into a life experience that you just can't go back from. So there's a feeling for people who've experienced it that if you know, you know. So there are so many emotions involved in this, but each one takes on a bit of a different quality than you've ever experienced it in the past. So there can be a really intense feeling of dread and anxiety when you start seeing these things, because even when maybe it's a known illness, maybe you've kind of seen it coming, there's a family history, there's a natural progression. Your future with your loved one, this specific loved one, is unknowable until it's happening. So things are really hard to plan for. You don't know how you're going to feel until you're in it. But you just kind of take it step by step. You may experience a symptom. It could be from any number of causes. And so being, up to date on doctor's appointments, as soon as you notice something, we want to be in a doctor's appointment and close contact and make sure that kind of each one that's noticeable, some kind of noticeable change is something that you're paying attention to and getting investigated.
So the fear of the unknown. So your mind starts to wonder and those kinds of things. Where do we go from here? What are we going to do next? Where do we find the right help? Those kinds of things, will run through your mind and kind of burden you and start weighing on you instantly.
Mhm.
So then as you see all this and you're trying to find help for your loved one, then the official kind of diagnosis comes along. It could be Alzheimer's, dementia, ALS, which you're familiar with, that you've gone through with your mother-in-law, Parkinson's, cancer, these life-changing conditions. So you have the shock, right? This is what it actually is, and this is what we're going to deal with. You could have the sadness, maybe some depression, anger, fear. You worry about what will the future look like for your loved one, and true, if they go into assisted living, will they be treated with dignity? Will they be loved and taken care of? So all of those things, they go through your mind and you're thinking about these things and you're losing sleep and, you're obviously probably not taking care of yourself as you should. So what are some practical emotional tools maybe a caregiver can use during this initial shock period?
Some tools that you can use, it depends on what point in the process you're at. So early on in the process, you may not have any kind of wherewithal about what's going on at all. And so you're going to want to be asking for help. You're going to want to lean on support of people who have gone through this kind of thing in the past. support can be professional support. Hopefully as things go on, you are asking asking their providers things that are helpful for going through this specific process. But as far as when you become an official caregiver, that's a whole world unto itself. So once you become a caregiver, everything that you've known kind of comes to a halt. And so it's reconfiguring everything that's going on in your life. It's paying attention to yourself and your own window of tolerance as you're going through things. So with the window of tolerance, it's good for everyone to pay attention to, but particularly caregivers who are, there's this weight that's on you all the time. It is unrelenting. It is always there. So just being aware of what place you are in where you can self-regulate. And then when things start to go up or start to go down. So with what's called the window of tolerance concept, there's the place where you can think through things pretty clearly. You can operate in a way that makes sense for you and for your life. But in those moments where things become overwhelming and maybe you haven't been paying attention to it, so maybe it creeps up on you, thought you were dealing well with things. But even when you are dealing well with things, you have great coping skills. There are times where that's going to be exceeded. Your stress level is going to exceed your current coping skills. And so we need to pay attention to when things are going north or things are going south. When things are going south or, below in the window of tolerance, we're going to a place called hypoarousal. And that's the part where we're doing the freeze response. That's where, we kind of tense up. We're not necessarily present for what's going on. We feel like we can't make decisions. We don't really know what to do. And it can be a feeling of being kind of paralyzed. So that can be a momentary thing, or that can be something that you're kind of falling into ongoing because you don't know how to cope with your new life experiences. So that's when we go into hypoarousal, which is, like
Okay.
it was low, like, hypotension. So the same thing with hypertension. With hyperarousal, we're going up into the fight or flight response. So we are feeling that anxiety. It's through the roof. We are either running away from things and escaping and saying, I can't, I can't, I can't, or we're attacking things
Mhm.
to plan and we're trying to figure out everything that needs to be done. But especially when this is an ongoing thing, how long can you do that before you start to burn out? So
Okay.
paying attention to where you're at within that process is vital.
Okay. So everybody, like you said, everybody is different. Everyone has different thresholds. And I think important part of it
Mhm.
is being self-aware of where you are in this journey. And so you have to take care of yourself or you're not going to be able to take care of that person.
Right.
So that's really interesting to me. So when you're a caregiver, you'll wake up, thinking about it. Am I doing enough? Am I making the right decisions? Do I have the right doctors? Or is the doctor prescribing the right medical care? Are they in the best facility? Do I need to move them? I mean, it seems like for constant questions that would pop up in someone's head who's trying to care for a loved one, this second guessing decisions. And how would you tell people to try to relate and handle those and not let that burden them down?
Well, from a therapy perspective, there is a concept called cognitive distortions. So
Okay.
this is not saying that all of your thinking is distorted, but what it's saying is everyone has thought patterns. This is a relatively short list. It's easy for anyone to kind of look at. You can Google it and just kind of look and see what's there. There are 10 that are really, really common. So some examples are things like catastrophizing. So when you're a caregiver, this can look something like, if I leave to take a break, they might fall. And then that fall in your mind is not going to be a nice and easy one that we recover from. It's going
Mm,
to be catastrophic. It's going to be horrific. It's going to lead directly to their death. And this is where a lot of that thinking comes in, that if I do anything to take care of myself, if I do anything to deviate from what's going on, if I take my eyes off them for a second, then the worst is going to happen. So being aware of cognitive distortions, how far your thinking is reasonable and where it goes to a place where it's really just torturing you and making a nightmare for you because it's occurring in your imagination. It's not something that's happening.
mhm,
It's fear-based thinking that you're so afraid of. It's going to dictate what you do. So being aware of those things
mhm.
and recognizing there's an amount of this that's helpful and reasonable and I need to account for. But there's a point where it gets to an unhelpful place where it is helping no one in this situation. So I need to really be aware of how I'm thinking and if it's realistic thinking.
Sometimes your imagination can be your worst enemy just in regular life.
Yeah.
Your mind can run and you start to worry for no reason, and that can cause stress. And, the stress isn't good on you overall. So just managing that and recognize it. Hey, is this even realistic? And understand that I can't do everything. I can't do it all. Things are going to go wrong along the way, and we'll handle them, when they come. We're going to do the best that we can to prevent those things, but we're going to do the best we can along the way. And understanding that it's okay for a caregiver to get help for themselves. Mental health is super important. When you fall and, let's say break your foot, you go to the doctor, you get yourself well. So when your head isn't right and you feel stressed and you're not taking care of yourself and you can't do the day-to-day task and you feel yourself falling away, it's okay to reach out for help from someone like Emily, who is a psychotherapist. And again, you can reach out to Emily Vallarta and find her through Psychology Today. But it's so important being mentally there and being able to take care of someone. So Emily, with your mother-in-law, she had ALS, and all, Alzheimer's, dementia, those kinds of things. When you see them slipping away and slipping away and fading physically, mentally, emotionally disconnecting, and you have those memories with this person, birthday
Mhm.
parties, holidays, all Christmas, all these great memories that you can't share with this person anymore. How do you handle that? Because, I've been told when someone has Alzheimer's, it's like they die twice, when they lose all the memories, and then when they physically go in the end. What are some coping skills, maybe to handle through that and to wade through those waters?
Again, one of the best things that you can have is just awareness of where you're at, what your thinking is, and one of the biggest things to focus on is normalizing yourself, because we can feel like my grief is, it's too much. I'm not that this shouldn't affect me like it is. And we may even compare, to other people. People go through this all the time. It's a part of life. It's not something that should be affecting me so much. When truthfully what's
Mhm.
happening is probably you've been grieving for much longer than much longer than,
Mhm.
started with this experience, because as people age, as, people get older, things start to happen, mobility things, memory things are not functioning like they used to. It happens to all of us if we live long enough. And,
Mhm.
parents and, elderly people that we're caring for, or even, younger people, family members, whoever we might be caring for, watching them go downhill and not be able to function like they used to. I believe you mentioned the word dignity earlier. That is one of the
Mhm. Right.
things we focus on and do our best to honor for them. But you've actually experienced 1,000 losses by the time you've actually lost the individual. So being really aware of that each time something comes up, each time you're sad about something, it's something new that you're grieving. So every
Mhm.
single time it's something that, oh, that's something we used to do together. I loved doing that together. It's something we've done my whole life. That's never going to happen again. And that's one small event in the midst of an
Right.
entire lifetime of experiences. So every time you feel sad about something, the empty chair at the table, all of these visual things, all of these timeline milestones are things that are going to cause a new grief event for you. So you're grieving all the time, just from, more mild
Mhm.
things to great things and all across that spectrum.
Yeah, grief to me is really interesting because it can hit you in the strangest moments and out of the blue. It could be mail that shows up, with that person's name on it, months later, or just, driving down the road and it just, it pops in your head. So little bit, a little bit more about grief and understanding grief and how to cope with grief. So the grief counseling is out there. Is it common for people to seek grief counseling?
Yes, very common. Even if they feel like
Is
I've
it?
been able to deal helpfully with everything that I've experienced prior to this, sometimes it is this loss that just shakes everything loose and they don't know how to deal with it. It's something brand new and something that nothing
Mhm.
that they've experienced before has prepared them for.
Yeah, definitely change. Right. So, yeah, everyone's going to pass away eventually. and you're mentally prepared for that, but still it hits you hard. It hits
Mhm.
you because you've lived with this person and known this person your entire life, right? So you've known your parents longer than anybody else, and then once they pass, it's your siblings that you've no longer known than anybody else. So it's certainly can be devastating. um, so we've kind of talked about the grief and the grief that's going to come, and then when they eventually do pass, probably feel exhausted. There's maybe some relief. Maybe you feel guilty because you do feel relief. Can you walk us kind of through those emotions?
Yes, that's one of the biggest things that people really get caught off guard with the loss of a loved one or with that experience. Feeling when, for example, when they go into a facility where they're cared for full time, there can really be a sense of, I abandoned my parent. My parent was there for me since I was born, took me through everything, got me from being a helpless baby to walking to, maybe
Mhm.
through college and, into adult life. They walked me through everything. And now I'm abandoning them in the most impactful period of their life where they're having to make sense of what's going on for them. So there can really be a lot of guilt for decisions like that because the loved one is not on board with it. They are not on board with their loss of privacy, with everything that goes along with that, with having strangers care for them. There can be a lot of guilt that's placed on the caregiver because of that. So
Right.
just recognizing this is the normal part of their process. Of course, they're losing all these things, but first and foremost has to be concern for their safety. So if they are not safe, truthfully, nothing else can matter. We can be conscientious and we can be careful and we can be tactful and we can talk them through the whole process and we can take their big emotions about it. That's our responsibility now is to take their big emotions about it and say, I know, I'm so sorry. This is just something we have to do and recognize that that's a part of it and do your best to separate what you know is best from this other thing that feels so terrible about this whole process. So just kind of living in those two realities. Yes, it is the best thing. And yes, it is going to suck.
Right. Right. Yeah, that's true. That's true. You got to come to that realization. It will suck. It's going to suck, and it's going to suck more as you get further down this
They are
path.
going to be
Um,
hurt. They are going to be angry. They may even accuse you of things, accuse you of abandoning them because it's the last thing in the entire world that they want is to lose that privacy, to lose that independence. But we have to do what needs to be
yeah.
done for them for their safety.
Yeah, it's definitely not easy. You hear of people getting bitter at the end, and then a lot of looking for forgiveness and those kind of things as the end gets closer. And the caregiver, is at the forefront of a lot of this. A lot of times it's one caregiver in the family that takes the brunt of this. And then, the people that are far away, they don't kind of understand the day-to-day activities of what goes into being this caregiver, where your responsibility is daily and it's ongoing. And, you kind of discuss the burnout, the possibility of the burnout. And the people caregivers need to take care of themselves. And I would say if you have a loved one that's caring for someone, try to get them some respite help from far away. Make calls, make contacts, reach out to the doctors, take some of that pressure off the caregiver. Sending them gift cards to DoorDash, something like that, where they can get a nice meal or something like that to relieve the ongoing the pressure of caregiving. It is a lot to ask of someone to do, and it is hard. It's a lot of hard decisions that come down the road. But Emily, like you stressed, it's important for that caregiver to also take care of themselves.
Mhm.
And we have the diagnosis we talked about, the diagnosis, the ongoing care, and the final passing. Can you give us maybe three big takeaways that you could give a caregiver that they should follow up on?
The absolute biggest thing, and I can't stress it enough. I know we have talked about it already, but it is the awareness of how you are functioning. So when you are consistently outside of that window of tolerance, you are consistently focused on everything outside of you and nothing within you, you start to lose the basics. You start to lose eating, sleeping, hydration, exercise. Your breathing is constantly elevated. Your hygiene can be affected. Your other relationships are fading away. We can look for all kinds of different indications and warnings, and we can look for all those things, but it's actually really simple. Are you actually functioning in a way that you would need to in order to maintain a basic level of health? So you have
Right.
to pay attention to those things. If those things are not functioning, then we stop right now and we say, what needs to be done? What support do I have? First of all, the support is going to be the biggest thing. So it's going to be family,
Mhm.
or hopefully you have it. Hopefully, we do have multiple people who are invested in this who can take turns and who can switch. So it's family
Right.
support. And with family support, everybody's kind of going through the same thing. So that has the benefit of we're all in this together, and that can, have a different kind of feeling. So, in addition to that, seeing a therapist, this is one of the most difficult experiences that people go through in life. So, I think it's really underemphasized in our society. It's something that, the people who have to go through it, and then maybe they don't want to think about it, discuss it too much. They just kind of move on, and no one else knows until they get there. This is something that I think this podcast is a great idea because it's hopefully going to bring more awareness to what's going on, what a global situation this is for people, and really
Yeah.
recognizing the toll that it takes on people. So as soon as people come in to my therapy practice, if they mention being a caregiver, what they tend to do is underemphasize it. They say, "Oh, I have this problem, this problem, this problem. Problems with my spouse. I have problems at work.
Mhm.
Also caring for blah blah blah." I'm like, "Wait, we stop right there," because most of the time, almost all the time, they minimize what an impact this is having on their world. And I've seen it myself with my mother-in-law with ALS. My parents were caring for my grandparents who my grandmother had Alzheimer's. They were both total care patients at the same time.
Mm.
So my parents and my aunt and
Wow.
uncle tag teamed. They lived at their residence, my
Mhm.
grandparents' residence, switched on and off. It started with every 4 days we switch, and then it became every 2 days we switch because they could not tolerate the 4 days anymore. They said, it's just too much. We are coming apart. We are fraying. We can't do this anymore. So, uh,
Right. Right.
really just kind of
Right.
recognizing how much it affects people, allowing them to recognize how much it's affecting them can often allow them to say, okay, I didn't think of it like that. I saw it as being, kind of a smaller thing, just something people go through, but it is such a huge thing that weighs on you and affects everything about your life. So as soon as I see the word caregiver, I say, hold on, we're going to dive into this.
Mhm. Yes. There's a lot to it. There is a lot to it, without a doubt. So again, we're speaking with Emily Vallarta. She's a psychotherapist in private practice, and you can reach her through Psychology Today. Emily, you've shared so many great insights with us, things we don't think about as a caregiver or as someone who knows someone that's a caregiver, and what they're going through and everything that's involved with it, from the doctor's appointments to medications to asking the right questions, finding the right care. And, if they are, you're taking care of them in your own home, right? They're there 24/7, and you can't get away, from that. So it's a lot for a caregiver. Emily, great having you on the show today. Before we go, any final thoughts you want to share with us today?
Every single person you talk to about caregiving will end up with the same thing. Take care of yourself. And what they say is so you can take care of the other person. What I advocate for is take care of yourself to take care of yourself. It's not only
Oh,
to
great.
take care of a loved one, it's because you need to be happy and healthy as much as you can be during this process. It is something that will take a toll on you, but you need to be well enough to continue to the next day, and you need to have a reason to get up. If all you're doing is caring for someone, you lose touch with yourself and you get further and further out to sea. The more you let go, and this is the first thing to go when you're a caretaker, is the things that mean something to you but feel unnecessary. Those things that you're passionate about, those, friendships, the things that feel like, okay, well, that's not a necessity. Those become necessities because they connect you with yourself. So the more you lose yourself, the
Mhm.
harder it's going to be to get up, the harder it's going to be to care for them. So care for yourself, and you will naturally be better able to care for others.
That's such great advice, Emily. I can't tell you how great it is to have you on the cast and getting the word out about this and caregivers and what they're going through and what they have to handle day to day. And then even at the end, right, there's even more to do. It's not over and understanding the grief. So, Emily, thank you so much. Again, it's Emily Vallarta. She's a psychotherapist in private practice, and she could reach through Psychology Today. You can go there and find her there. And as always, if you need some help, reach out and get help. There's plenty of resources available. So thank you, Emily, for your time and your insights today. We want to thank our sponsor today, which is Baldwin Dental Care and Dr. Kimberly Simons and her team, providing top-notch dental care for decades, cleanings, implants, Invisalign. You name it, they can do it for you. Reach them today at 636-227-2552. Emily, thanks again. We appreciate your insights and your time today. Everyone, have a great today and an even better tomorrow. Thank you.
That wraps up another episode of the Fit, Focused, and 50 podcast. Thanks for joining us. Have a great day and an even better tomorrow. And until next time, find us on all the socials. Please like, follow, share, and subscribe. And as always, feedback is welcome.